Hi, good afternoon. I guess, other parts of the world, I don't know exactly. I guess it's evening time frame for some of you guys, but, or maybe overnight. So I'm really impressed if that's the case. But thank you guys for joining. This is really informal. I have a few slides to just talk about COVID in general, and then kind of move into how it affects our patient population with regard to skills for life, and then Mike St Onge will join or kind of comment from his perspective, and then we'd like to open it up for kind of discussion for what you guys, there's lots of different people on here, whether they're actually amputees or whether they're in healthcare, taking care of people in this situation. So I think it's a really diverse crew, and I'm just going to talk for a few minutes, and then really most of this is going to be kind of opening it up and talking about whatever issues that come up for any of you and your individual role and why you're here. So thanks for joining us, and John and Sean, thanks so much for organizing this. As most of you, I think we're all sort of tired. It's been almost a year since we've entered this pandemic. I think there's lots that we've learned. There's certainly lots more to learn. I spent some time this weekend putting these slides together, and I realized even last night, as I listened to this WebEx on emerging SARS variants, things change day to day, and it's really kind of interesting. So it's kind of sad. 3 days ago, I put this slide deck together, and then some of it's probably a little obsolete, but I think the point is we do need to stay up to date, and we need to kind of be vigilant about understanding what the latest information is. So I think one of the hot topics in the news right now is how we roll out the vaccine program, and a lot of the difficulties that different states have had with that. So we'll talk a little bit about how that's rolling out and where you can get good information from. I mentioned a WebEx that I joined last night, this webinar on emerging variants, and I thought it was really interesting. They had some thought leaders that talked a lot about their perspective, and I think at the end of it, the take home is we need to be transparent about the information in healthcare that we provide people. We need to be honest about the fact that we don't know what we don't know, and that every time something new comes out, that it's important to be open about that and to tell people about it. And just the other take home was it doesn't matter necessarily that some people have the vaccine and others don't. For a long time going forward, we're still going to have to do social distancing with face masks and sanitizing areas, and just being smart about it. I think in the news media, a lot of stuff is sensationalized, and so they talk about variants, and they talk about it like it's some mutant, like that, and I think it projects a lot of kind of scary, a scary situation for people and the uncertainty of it. But the truth of the matter is, viruses mutate all the time, and that's part of what happens, and that's how they perpetuate. And it's really nothing different than what we've already contend with the flu virus. Not to say that this is anything like the flu. Do not misquote me on that. But what I want to say is that we are learning. We need to be transparent. And then I think from this group, we need to just be honest about how the uniqueness of people with disabilities and what they face in this situation, and how we can really address it, because I think we really need to focus on that for our patients. So just to kind of talk about statistics, I know everybody kind of is probably tired of hearing a lot of this stuff. The cases worldwide, just to kind of put this into perspective, you can see the dark blue is really where it's the most. And so this is just in the last 7 days. And then global deaths also in the last 7 days. So that's pretty sobering, because the United States is top of the list. And so we'll spend a lot of time on that. And, forgive me if this is a little intense on statistics, but I do think we need to kind of understand it a little bit before we move on to less mundane issues. But total cases and deaths by state, I think, and let me just put in a plug for the CDC. I think that if you're interested in getting accurate information, go to the CDC. I think that the up-to-date stuff, the other good place to go for information is Johns Hopkins. And I think you can kind of do your own research, but this has been updated. This website started January 21st, 2020. So just this weekend, we had the anniversary of when they updated this website. And now these are the statistics as of this last Saturday and Sunday. And so going from there, I think the other point to make, and I know this has been kind of a hot topic because the highest incident of COVID is in young adults, college age kids, and just starting work. And so, and unfortunately, most of those are asymptomatic. And so the real problem, as we all know, is that, they all often go out and do their own thing, and then they come back and might interact with people that are at higher risk, particularly over the holiday season. And so that's something that we need to really talk about and why this thing is perpetuated. The other thing, let me go back to that. Let me just make a comment. The new variants that are coming out, they're supposed to be more transmissible. And while they might not be more deadly, the problem with that is it takes healthcare resources to address those illnesses. And so if we overload our healthcare system, that's going to be a real problem. And we need to understand that and why it's so critical to continue with masking and social distancing and sanitizing. And then, deaths by age group. We all know that this affects people, in the older population. But when you start talking about it, COVID is 10% of deaths by other causes in anybody over age of 45. That's pretty significant. And so, so now I'm going to switch gears and kind of talk about the vaccine program, because I read an article just last night and talks about when are we going to be able to really get out of this pandemic and return to normal. And it's estimated that 260 people are eligible in the United States for the vaccine. The goal of the vaccine program is to ensure safety and effectiveness of the vaccines. Obviously, it's to reduce transmission, morbidity, and mortality from the disease. It's to help minimize disruption to society and the economy, including the healthcare capacity, which I think is the biggest issue right now. And just to put that in perspective, I get daily updates from my healthcare system in Texas Medical Center. And we blew past, the last couple of weeks, we blew past the initial spike we had in July. And so now, that's a real problem when we start talking about hospital systems being able to handle the number and the volume of patients that are coming in. And then the other big issue is how we ensure equity of allocation and distribution of the vaccine. And so LTCF is the long-term care facility residents. Those are obviously the ones that we really need to vaccine first. And then, so we're talking about morbidity, mortality on that end, and then preserving societal functioning. That's where healthcare personnel come in. If you haven't seen this is, again, these are all, this is all information that I got from the CDC website. So if you want to get updates, that's a really good place to start. But it talks about the different phases and how we're going to roll this out. I thought this was an interesting slide to look at. Talks about different in phase 1A. That's again the healthcare personnel and the estimated people who are eligible to get the vaccine. Moving on to phase 1B, where you have essential workers. And it's a little interesting on how they're defining essential workers. There's sort of a phase 1B and then a 1C, and I can talk more at length if anybody has questions on that. But and then we move on to 1C, which is lowering the age group now from 65 to 74, and then the rest of the essential workers. This is also one of the key areas I want to talk about, which is the high risk medical conditions that then qualify for people for the vaccine, and what that means and how they've come up with that. And then phase 2 is everyone else that might be eligible over the age of 16. So what are the high risk medical conditions that qualify somebody? And really, I don't have to necessarily read the list here, but some of the ones that you might think, and certainly type 2 diabetes, severe obesity, chronic diseases. Those are all some of the things that, probably obvious. But I've had a lot of questions from patients in clinic just this week, do I qualify and how do we define that? And so I've really kind of talked to a lot of with patients on working with their primary care physicians and getting on a list. One that might be at risk for or conditions that might increase risk, I have listed here. Something like asthma, kind of a lot of respiratory issues on this one, or respiratory diagnoses. The one thing that it doesn't include, I think, interestingly, is people with disabilities. And I think you're going to see these lists changing. And that was the one term that they used in the WebEx last night that I thought was interesting. This is a really fluid situation. And I think these the numbers keep changing, as well as how they're defining who is going to qualify for the vaccine. So when we talk about vaccine distribution, an article came out this weekend about top 10 states versus the bottom 10 states on how states are doing in rolling out the vaccine program. We've certainly seen a lot of issues with that. And not to get, again, overrun with issues here, but as of Saturday at least, 41 million doses were distributed, and then total doses. So distributed is sent out to be administered, and then administered, we have 20 million. So about half of the ones that were distributed were administered. And then, you can see the numbers here, but we have a long way to go. When you talk about 260 million people that are eligible for the vaccine and how we're going to get there, it's going to be tough. And I know our hospital system is, we made a list of the people that qualified for 1A and 1B, and I think it was something like 190,000 people in our hospital system that's eligible, and how we get that done is challenging. So, I get questions all the time from my patients. Are you going to get the vaccine? Obviously, yes, I did. I have my second dose, I think it was a couple of weeks ago. What are the side effects that I experienced? That's another common question. First dose, my arm hurt a lot, but didn't really have any other symptoms. Second dose, and by the way, I had the Pfizer vaccine. A lot of the people that I work with have done the Moderna. The difference is Pfizer, it's a 3-week interval between first and second dose. The Moderna is a 4-week interval. After the second dose, I felt fine for 24 hours, and about the 28, 30 hour mark, I had severe flu symptoms. So feverish chills, body aches, went to bed, and 6 hours later I felt fine. People are having different responses to that and different symptoms, but I think that's kind of generally what I've heard. So what is it that we want to do to continue? And even if we have the vaccine, we're still going to have to do this, which is mask up, sanitize, and social distance. I think the one thing that this patient population is very unique for a lot of reasons, and I obviously put in there sanitize as opposed to hand washing, but I want to have Mike talk a little bit about his experience with that and what it means to mask up, to sanitize terminal devices on prosthesis, and then to social distance, especially for our patients who require a caregiver to come in and help them. You know, I have a hard time when I'm in clinic keeping a mask on, right? And I can maneuver it. It's not fun. It's really difficult. Well, you can imagine, you know, what people with bilateral upper limb amputations have to deal with. It's certainly one of the reasons that our group decided to postpone the Skills for Life conference because we just didn't feel like it was safe. So, you know, I make a couple of funny jokes on here. You know, my favorite is, you know, how we wear masks is really important. It's certainly, you know, if you wear a mask like the lady in the center, it's really probably not doing much. You know, I got this other one. It's supposed to cover your nose too. You know, just so I can remind people that it's not, doesn't do any good if it's sitting underneath your chin. And then of course, you know, I couldn't find one with an arm prosthesis, but certainly in this patient population, it's really important that we, you know, understand the complexities of what it means to mask up when people are going out in public. And just have a few more slides just to talk. If you're interested, please, again, go to the CDC website. But I personally think people with disabilities as a unique patient population, I think that they should be on the list for high risk comorbidities that should qualify them sooner. Whether or not we can advocate for that, you know, I think that's one of the real key questions that this group might be able to comment on and how we might do that. But, you know, if you are concerned at all, please talk to your healthcare provider. You know, obviously we talked about some of the difficulties and what that means to social distance with a care provider, as well as sanitizing and how you're going to continue with that. Obviously, it's really important, and many people with bilateral upper limb amputations have underlying diseases that might, you know, cause them to be at higher risk for an infection. So obviously, that's an important issue to address. You know, and if you do have a care provider, having a frank conversation with them, making sure that, you know, if they're having symptoms, that they don't come in and expose you into your home. And that they follow the same typical guidelines. If there's other equipment issues, they need to be sanitizing the equipment that you're using. And so that's really, I think, important and unique to this patient population. And then be prepared. What happens if somebody who helps you as a caregiver becomes ill themselves, and what you can do. And this is just a you know, list that they've come up with. I think it's a good list. I think that we can probably kind of brainstorm and troubleshoot some of the other issues that some of you are experiencing. So hope I didn't take up too much time. That's all I have. Mike, I'll turn it over to you, and I'll advance so you can just let me know.
Thank you, Dr. Melton. I appreciate that. So one of the questions that came through on the chat board was, you know, how to put a mask on and possibly even take it off. In the beginning, this was something that was pretty difficult for me, and I would ask help from family members and things like that. But of course, with everything else, it's like, I just need to learn how to do it. So let me figure it out. And so I got my mask here, and it's usually about pre-positioning. So where does my hook need to be when I'm actually letting go of the ear loop so that I'm not hung up prosthetically holding the ear loop. So what I'm doing right now is I'm doing more of a.
Hey, Mike, can you go through the slides first and then do the mask after so that we can stop the screen share?
Sure. Okay.
Thanks.
So, you know, Dr. Melton alluded to it before, and obviously Sean as well, the whole Skills for Life, you know, upper bilateral workshop. This one was from 2018. So back pre-COVID, when you could actually get together, go out and have some fun. And we're looking to do that again in 2022. But this year, we're going to do the next slide, please. This year, we're going to do Skills for Life 5.5. And it's going to be a virtual event. And so here's some information here. You can go to the website, Enhancing Skills for Life, and kind of, you know, set aside the date so that you know when it's coming, and we'll have more information about this coming in the future. We're still working on it. It's something that we're actively pursuing. And of course, the Facebook page and other socials that you can find our information. Next slide, please. And of course, we're already talking about Skills for Life 6, kind of more like save the date type thing. And hopefully everyone will be in person and we'll be able to get that communal sharing going that is such a big part of Skills for Life. And that's the
All right,
end of the
I'm going.
slides.
Yep, there we go.
Yay.
And I'm gonna click, if everyone wants to click on speaker view now, then you can make Mike bigger in your window.
No, don't make my face fatter. What are you kidding? I'm already huge. I got my COVID-15. So what I was talking about before was I'm going to supinate my hook or palm up so that when I bring it to my face, I'll be able to loop it over my ear. And then when I open my prosthesis, I'll be able to let go of the elastic and drag the hook away. So the other thing I'm also doing is I'm going to help support the mask with my other residual limb. And that way I can hold it in place a little bit and go over my ear. And then, so now it's already caught on the one side. So now that it's caught on that side, a lot of times, let me kind of drag the screen down a little bit. Right about there. So I'll flip it around towards the front of me. So now I can see the other loop. And again, I'm going to do the same thing. So my hook is supinated. And might even do that. Like normally I don't let go of it. I just kind of do it right away. So now I've got the opposite side and I will push it. Nope, that didn't work. Sorry, I dropped you. There we go. That's what happens when you try to do too many things at once. That better? Not
Pressure's
bad.
on, Mike. I'm impressed.
So let me come right back to about here. All right, so I kind of shake my face and get it to come to a point where I can see it. And then I've got the mask again, now it's twisted. So I'm just gonna start over. Because, you know, that happens. You know what I mean? If I don't get it right the first time, then, you know, just do it again. Hook in a supination, kind of support the mask with opposing limb. That way, when I put tension on the ear loop, I'll be able to catch it. And normally I'm doing this in the car and I have the driver's mirror so I can see better. I'm trying to use the little film screen. So now I've got the opposing ear loop and I just drag across over the top of the ear and under. And then if I need to adjust from there, kind of drag it, residuals, pinch the nose, and there we go. Then
Well
when it comes-
done, Mike.
when it comes time to take it off,
Can I share another option for a mask as well?
sure.
Yeah, because I mean, mine's the same thing. Where you were struggling there, that's how I was like craning my neck, and it would drive me crazy because things always come off my ears. So I found these SafeMate masks. There we go, off Amazon, and the ear loops are actually connected by a band in the back. So if you can slip it over your head, so I just grab it with my chin, pull it over my neck, and then, I mean, yeah, you could probably do this with your hooks as well, as grab these ear loops and connect, pull them up. And then if one ear loop does come off, the mask always stays on because of the band in the back.
Nice.
So that's another option that I found a little less frustrating, I guess.
So for my
Awesome.
OTs out there, what's the main thing we keep seeing? Range of motion, flexibility?
Yeah, like you're not supposed to have a neck ache after you put your mask on.
You know, so when a patient is like, why do I got to do this 10 times? You're like, because you're going to need it, you know? But yeah, so that's a couple different ways to put on a mask. The KN95s, where it goes over the back of my head, they're a little bit more difficult, and I just kind of stopped farting around with it. So I went with the surgical type, and it's just easier and faster. And I got a good deal on a you know, multi-pack bunch, and so I might have mine for a couple days in the car, and then go back to another one. I know people like to buy the reusable mask. Yes, Sean.
Hey, Mike, in a second, will you make sure to get to your story that happened to you a month or two ago? And then I definitely want to open up to more questions and have people, you know, other people demonstrate their methods, or if they have questions saying, well, your setup is a little bit different than mine. How do you recommend I do it? Because I'm this. But if you'll go ahead and tell your story.
Okay. Well, I'm going to kind of finish up on the mask part, and then we'll go to the story, then we'll go to the terminal device cleaning. So was there anyone else that had their ways of putting on a mask, or that's similar or different?
Well, I put mine on pretty similarly as you do. I'm a bilateral above elbow. I don't do any things with my hooks. My hooks stay the same. As long as I have a mirror, I'm able to get one on. It's kind of like you think at the beginning, I'll never be able to get this on by myself. But then once you spend some time on it, it may take me 30 seconds to get it on anymore. But yeah, it's pretty similar to what you do, Mike.
Yeah, it's just practicing and keep chipping away at it. And it's like everything else. It just, oh, okay, I do this, and off I go. You know, into the store we go, into the store we go. So, okay. And then to Sean's point, October of last year, when things were kind of really starting to pick up around here in Tucson.
Hey, Mike, for those that
Yes.
don't know you, will you give a rundown of your limb absence, limb loss?
Sure. I'm a quadruple amputee. I've been this way since January 2000. I got pneumonia, sepsis, gangrene whacked the limbs. 5 months, 4 different hospitals, 2 months in a drug-induced coma. I woke up, everything was gone. That was January to May of 2000. I got my arms first around the 4th of July. I was bilaterally harnessed. I got rid of the right, and then I got lower extremities. I think it was the last week of August. And then when I started driving again the following January, that was it. All bets were off, and I've been rolling since.
You know, Mike,
So
that's a really impressive elevator speech.
Yeah. I've only done it 3 times a day. So, yeah, you know, I've been this way for a minute, for a long minute, and I'm really blessed with a lot of support from my family and friends. And then even the support where it's more of like the tough love approach, where, oh, no, let him be on the floor and struggle for a minute. He'll figure it out, you know, because really, honestly, that's what we need. We need to be able to have that frustration and then realize, you know what, I'll work through it and it will get better. And a lot of times it's usually fear of the unknown. And so that's what happened last October. Was I was concerned because I am immunocompromised with a splenectomy from 74, somewhere around there. So, you know, when I get sick, I get really sick, and I got to watch things when I get a fever. And with this being a virus, you know, I'm like, I don't know if I would make it through the next major event in my life medically, you know, so I take it pretty serious. I'm not overly freaked out, but I'm cautiously concerned. And everywhere I go, I do wear my mask. I'm around other people that wear their masks. And, you know, I still have a lot of prosthetic needs because I break stuff because I wear it. And I was at my prosthetic office, and this was on a Friday. I got a standing appointment for 2 hours every Friday, and we're working on lower extremities, some upper extremity stuff. And then Sunday, I got hit up on a text, and my prosthetist was like, oh yeah, by the way, I turned positive on Saturday. So, and for about an hour, I was like super concerned, freaking out, almost not almost angry, but like, damn, man, I tried everything I could. And then when I started down that path, I went, well, you tried everything you could, you did the best you could. And so instantly that negative energy went away and became a positive energy for me, because I no longer had to be afraid of getting exposed. I had been exposed. And now to the next step, isolate myself for about a week inside the house, set up the testing appointment so that I can go get tested, and my test results came back negative. So that hour that I lost of like, now what? It's gone. It was no point. I didn't need to do that. I just needed to go, okay, this happened. What's next? So a lot of times when we're trying to do things, whether it's put a mask on for the first time or dealing with this pandemic and, being around strangers, going to the supermarket, if you got to go out and do anything like that, just give yourself that mental headspace to realize that do the best you can do and then go from there, and usually things turn out all right, even when we don't necessarily believe that way. So back in March of last year, right, kind of started at the beginning of the pandemic, I had a fun thing happen to me. I went ahead and burnt down my carport. So had lots of contractors. I had lots of people coming through and the kind of stuff like that. And it was the same thing. I wear my mask. I stay away from people as much as possible and just do the best I can do. So when we're so anxious or, distracted by the rest of the things that are going on in life still happens, and just give yourself a minute. It usually turns out all right. So moving on to the next thing, Dr. Melton had asked me, talking about how to clean terminal devices and prosthetics and things like that. So I do a fair amount of work in my yard, and I'm going to go ahead and soap and water wash my prosthesis. I'll just get liquid soap on this residual limb and rub everything all over and clean it that way and do stuff like that. But usually about once a week, I'm also going to take a spray bottle that has rubbing alcohol in it, and something around 75% is better. It'll denature the virus a lot better than 70%, but I think this particular bottle has 70%, and I'll take this outside and I'll just start spraying the entire prosthesis with it. The terminal device, the forearm, inside the socket where my arm is going to go, and just to make sure that it's nice and clean. And this is something that we should be doing anyways, with whether you wear some kind of roll-on liner for an upper or lower. You want to clean it with some rubbing alcohol from time to time, because you're going to kill that bacteria that's in there, and that odor, that smell, that's bacteria. Besides washing them daily, if you really stop and think about it, especially roll-on liners, they're in more intimate contact with our body than our underwear. And you wouldn't, take your underwear off, throw it on the floor, and then put them on again the next day. I hope not. Seriously, just hope not. But so that's why, you just want to clean your stuff, clean. So I'm a bit anal with the cleaning. I try to really stay on top of it, but again, I do the best I can. And I'm opening it up to see if there's any questions that people might have for me or Dr. Melton or Sean, and or share your own experiences. Julie?
Okay, can you hear me?
Yes.
I was real careful like you, Mike, and from beginning of May to Christmas, I didn't go anywhere or do anything, but I went over to a friend's house December 6th, and the couple had COVID and didn't know it. And John and I both came down with it. We were both very worried about all the things that you said, very angry that, that couple gave it to us, but they had no idea. And John was very worried if he or I ended up in the hospital, who was going to take care of me. And then I also, for the people that don't know, I had to have 2/3 of my right lung removed from blood loss. So I have a little lung and a big lung. And so if I had to go on a vent, I would need 2 vents. And so we called my ER surgeon when I knew that I had it and asked him if he would take our case if I ended up in the hospital. But luckily we came down with it December 6th. We isolated for 2 weeks to December 20th. John only had 3 days of diarrhea and a headache. I, on the other hand, had severe nausea, just like the flu, for a week. And all 4 of my limbs felt like they were on fire, like frostbite. And it just went to those outer limbs. And 2 nights in a row, I couldn't sleep because my limbs and my legs hurt so bad when I laid down at night. But I came through it, survived, felt pretty good that I didn't end up in the hospital and that it didn't get down my lungs. It mainly stayed in those outer limbs. And my doctor said that we were probably okay with the antibodies for 3 months and then to take the shot after 3 months. So that's our plan. My question today is any other amputees gotten COVID, and did you have that fire in your limbs feeling? Anybody?
Everybody's on mute, and so hopefully it'll take them a little bit of time to unmute and respond if they do.
It was a very scary time for us.
I didn't get this. I didn't get the COVID, but when you say your limbs were on fire, that just reminds me of when I got sepsis, because my hands and my feet hurt so bad.
Yeah.
So
That's
I
how
wonder
it felt.
Yeah. I wonder if you had a little bit of sepsis going there.
Or just circulation,
Yeah.
you know,
Mhm.
maybe you're
So-
shunned a little bit.
So, one of the things that we're seeing with COVID is the issue of, it is almost like an ischemic issue, but it's an over abundance of a release of things in our system that tend to form clotting issues. And so whether it's clotting causing strokes or whether it's clotting causing vascular problems in their distal limbs, I think that's likely what is going on. As I started the conversation, I think we don't know what we don't know yet, and we're going to learn a lot going forward. But the mechanism certainly seems like that, like it's overloading the vascular system and causing clotting agents for your body, and that's really I think what's happening from a pathophysiology standpoint. So
What about
yeah.
just inflammation as well? If certain sections of the body are retaining a lot of fluid or inflamed, then that might be pressing on the nerves or whatever kind of neuroma might be going on at that point. I don't know, just kind of.
One I had read, it said that COVID tends to affect everybody differently, but it goes to your weakest spot. And I started thinking, well, maybe where my limbs had been cut and the nerves damaged, that was my weakest spots. I don't know.
Mike, can you hear me?
Yes.
Yeah, I did not get sepsis, but my wife and I got sepsis obviously because I didn't get the COVID, but my wife got it back in last end of March, early April, back when they were, unless you had a fever, they wouldn't test you, and they were really specific on everything you had to get a test. So she didn't even really get tested until maybe about a month and a half afterwards. She went back and they found out she had the antibodies. Luckily, my primary care doctor treated her as if she got it. So they treated as what the standard procedures was back then for the coughing, the congestion, everything. So she treated her as if she had it, so it worked out well. But what I wanted to say is, I didn't get it. I didn't feel bad at all. I had no issues with it. And, I do use a lot of the hand sanitizer. Being a quad, every time I have to put on my liners, I'm constantly, using the hand sanitizer to put on liners, using hand sanitizer to put my legs on. I wipe down my hooks quite a bit with hand sanitizer. So the hand sanitizer stuff does work. And she isolated, she was in the other room, but we had no real issues with it, being that she had it and I didn't have it. So it worked out pretty well for us.
That's awesome. I'm very relieved to hear that. Yeah, the hand sanitizers are great. They're obviously a lot more available now. Just be careful of caustic solutions like, bleach and water, or bleach wipes and things like that, because bleach is caustic and it can react with metals, or maybe if you have a silicone glove or other silicone items, liners, the gloves that go over the myoelectric hands and things like that. So you try to be careful. Generally what I do is I'll, read the pamphlet that comes with the item from the manufacturer. Like they say, you got to change, like I wear pin liners and they're like, oh yeah, change your pins once a year. And I tell my prosthetist and they're like, what? I'm like, yeah, it says so in the literature, once a year. Your pins, like, they're like, oh, okay. I'm like, yeah. So, read, educate yourself. You get to be your best advocate.
Just a comment on sanitizers. When I was, researching stuff this weekend, the CDC also has a list of accepted hand sanitizers. If any of you kind of paid attention, I mean, it was kind of in the news on what is and isn't. There's an exhaustive list on there. Most of the problem ones that are recalled are from Mexico and China. So just, look to see on whatever you're using that it is an accepted, approved by FDA standards.
Yeah. Do you remember the alcohol? I know it's the wood alcohol, the methyl something alcohol that's not good if you absorb it through your skin. Do you remember which one that might be? But yeah, the ones from Mexico and China, obviously, try to stay away from.
Yeah, it's an exhausted list, but.
So I just wanted to let you guys know about, 15 more minutes. And so if you guys have questions that you don't feel comfortable asking online, you can put them in the chat and, we can get back to you later, or everyone's free to unmute themselves at this point if they have questions. If it gets a little too loud, I might mute you from my end, but yeah, feel free to, open it up for conversation like you've been doing, and any other questions.
Hey, Mike, I was just going to add, I think you were talking about wood alcohol.
Yeah.
Anything that has wood alcohol, you should not use on your body.
No, it's not good.
Nor should you swallow it.
No, do not ingest the bleach. Do not ingest the wood alcohol, all that kind of stuff. Like, not so much. But there's a more technical name, because isopropyl is fine on the exterior, but I think it's methyl something, I forget, but it was on my local news as well, being in Southern Arizona. They're just, saying, hey, beware of, stuff that's coming in. Just read the ingredients and then go back to the CDC, the website. It'll has an exhaustive list of what not to use.
Yeah.
Yes, Julie.
Mike, I didn't realize I always clean my liners with soap and water, John does, but you actually take hand sanitizer and clean them too?
No, not the hand sanitizer. I'll take the rubbing alcohol and put it in a spray bottle, invert the liner, and then just kind of mist the liner and let it dry on a towel or something for a couple minutes, and then re-invert the liner. If you leave a liner inside out, depending on the liner manufacturer, it will break down that liner. The liners I'm thinking of are Willow Woods, and I use them for crawling. And if I leave them turned inside out for too long, it'll crack. They'll start to crack and just wear down a lot faster. So all the manufacturers, will tell you, turn it inside out, basically wash it with whatever you're going to wash your body with. You don't necessarily need to use antibacterial soap. And the reason for that was the alcohol, because they don't want a lot of alcohol on a
Right.
liner. It'll dry out the liner. But doing it once a week, twice a month, will kill kind of stray bacteria and, the odor. If you've ever worn, especially a lower extremity liner for a long time and you take it off and you're like, isn't that great?
They smell.
Yeah, the smells. So that's from bacteria, and it'll help with that. And also, if you notice on like the brim of the liner or even across your limb, if you start to develop a rash and hot spots, that's also usually from bacteria. So you're inside of a dark, moist environment, which is obviously the perfect growth area for bacteria. So hitting it once a week, twice a month, with a little bit of spray alcohol, isopropyl, and then let it dry for a couple minutes and then turn it, right side out.
Well, see, I think I've been messing up because my prosthetist said to turn them inside out and clean them and then hang them to dry. And then I put them on the next day. But you're saying don't do that.
So I've had multiple different liners, and the ones that I'm currently wearing it's a Isoros Dermo something or other. And those are pretty durable because of the type of material that they are, that if I leave them inverted overnight, they're generally okay. Other liners that I did that with which are more of a medical grade silicone, I'm thinking specifically of ESP liners, Willow Woods, and I forgot what the other one was. If I left it inverted, and I'm talking like, after 6 months, you can really see the cracking and how it's almost not necessarily dried out, but they're more brittle. They break down.
I have Willowwood.
We have another question. I think this might be for Dr. Melton. It says, is there data IDing COVID causing sepsis or causing amputations or worse?
Sorry, let me unmute. Yeah, I saw that. Bill, good question. There are lots of kind of case reports out there that like severe COVID causing viral sepsis. I think we're going to see a lot more going forward. It's not, I haven't seen like series or I think it's more case reports. So really good question. I think that's something that we're going to be looking at going forward. When we start looking at all the compiling sequela of COVID, there's certainly some long-term effects from cognitive effects that people are talking about. I think some of the data is getting lost a little bit in that a lot of the people that have had amputations, the severe cases that ended up with amputations, many of those ended up passing away. So we don't know. I think that the numbers are going to be difficult to track. Good question. And, that's something that we've been kind of talking a lot about, because we certainly do see, at least anecdotally, I will say I did 2 consults in the last month of COVID patients that ended up with amputations. But actual hardcore data, I don't think we have yet. And I think it's going to be hard to track. So.
Hey, Vala.
Question for Dr. Melton.
Mm-hmm.
Before we stop, this is Mary Kelstad. Back in 2005, 2006, I fought stage 4 Hodgkin's lymphoma, had a tandem stem cell rescue. And after I had my new amputations, my new immunizations for my new immune system, I developed pretty severe muscle weakness in my legs, similar to a syndrome where the muscles become very weak due to different reasons, but then resolves itself. I'm I've always, and I always worry getting a flu shot or a pneumonia shot for that reason. Has there been any research, to your knowledge, Dr. Melton, about the COVID vaccine related to people with very, very compromised immune systems?
Really good question. Because it's mRNA technology, it should be safe. And the ones that you have to be concerned about are live vaccines. And so those would not be ones that you would ever get. So having said that, so my mom actually recently had lymphoma as well. And so she's gone through all her immunizations, and MD Anderson said, no problem, go ahead and get the COVID vaccine. Again, for anybody with immunocompromised who's gone through something like that, it's just live vaccines that you're worried about.
Okay, thank you.
Yep, no, really great question. I see another one on here, Sean.
The live attenuated, LAV, live attenuated, something like the flu, when it was a nasal mist, your flu shot, you could do the nasal mist, that's a live attenuated vaccine. So stay away from that.
So Carl Lindborg, hi. He just mentioned on the chat board, Dr. Fauci is now, sorry if I said it wrong, is now recommending double masking. Is there any other techniques you would use to double mask?
Well, if I can just make a comment on that, because we did address that in the WebEx last night with the thought leaders for emerging variants. Everybody on the call who is making decisions from a public health standard recommendation is that whether you double mask or not, the issue is just mask appropriately. Double masking, what it does is it lets fewer particles in. It's not that the variants, while they might be more transmissible, it's not like they have developed this mutant, claw that's going to cut through cloth on a mask. It's not that there are smaller particles that are getting through the mask. If you wear an appropriate mask and you wear it appropriately, covering your nose, covering your mouth, I think that's fine. All the people on the call last night basically said the same thing. So whether it's,
Wasn't it also, Dr. Melton, like it's the amount of layers, like if you got a 3-layer mask versus a 1-layer
right.
bandana, okay, yeah, well then a second mask if you're only wearing a bandana, because now you got 2 layers.
Yeah, if you're wearing a crochet, a pink crochet
Right.
across your face, you're probably not gonna pick up most of those. No, I mean, that's the issue. If you wear an N95, that's probably the same as double masking on some of the material that people are using for masks.
Yeah.
And
So-
I don't know if you saw Bill's question just now. He said he's seeing varying information regarding having to delay the COVID vaccine if you've recently received the flu shot.
Go ahead, Bill.
I don't think that that's true. I don't know. I haven't read anything on that. I'll have to look that up, Bill. I'm not sure. If you want to.
I can say I volunteered at the Memorial Hermann Mass Vaccine Clinic 2 weeks ago, and there was a list of 6 questions that would, if you answered yes to any of them, you would not qualify to get the vaccine that day. And this was not one of those questions. It talked about receiving antibodies, it talked about fever, or if you've had the virus in the last 14 days, but having a flu shot was not one of the criteria that prohibited you from getting it that day.
Thank you. It happened to be my prosthetist who said he just recently got his first flu shot, or rather a vaccine, and learned that here in Delaware, but then went online and the appropriate websites didn't indicate that at all. So
here in Kentucky, they've been saying that too, that you have to wait 2 weeks before you can get the COVID vaccination after you have a flu shot.
I think that's what my PCP recommended also in Arizona, because it was January and I got my flu shot, and she said I might have to wait a minute for the COVID, but we both agreed it would probably be the end of the first quarter, because my group is a 1C, and I just watch my state's, my county's website, because not only do they have 1B, but they have 1B, 1A, 1B, 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 1C, 1B, 1D.
Gosh.
So, they're really micromanaging, and it boils down to, I think, fundamentally is the amount of doses that are available for each county,
Right.
each municipality. That's gonna, how quickly we can get herd immunity by getting most people vaccinated.
Thank you very much. You're all rock stars.
Julie, can you see this liner? You see how it's like all
I
cracked?
do. Yeah.
Wow.
So this is a willow wood, and this is what happened to it from leaving it turned inside out
Oh my
versus
gosh.
the same liner and the back side of the liner. So if you start, obviously this is a older liner, like much, much older, but generally, yeah, the manufacturer is going to say on their piece of paperwork, leave it right side out and not inside out, to cut down on that type of cracking.
That's good to know. Mine has not cracked like that, but I usually get a new liner each year.
Mhm.
Maybe it hasn't had time to crack.
Yeah. So, and also if you leave it cupped like this at the distal end, where that sharp fold is, it's not meant to bend that way. So that sharp fold will eventually over time cause it to stretch and crack in a manner which it wasn't designed to be. So
Good
you
to
gotta
know.
look at it that way.
Thank you.
So real quick, I'm gonna, like the official part of our presentation today, we can let those go that need to go. But for anyone else that wants to stay on, we can keep this up for another half hour or so. If you guys just want to chat and ask more questions of each other, happy to do that. But official end of the presentation, we'll stop the recording now and just hang out if y'all want to chat with each other. Thanks again to Dr. Melton and Mike today
Yes,
for
thank you.
hosting this and being willing to share and educate, and be on the lookout for our next public topic. It'll be in April with the Amputee Coalition, and I'm hoping it'll be with the Amputee Coalition. It'll be on how to find your resources or where to find resources. That's still kind of in the works, but we're hoping that that's what is going to happen. So, but yeah, hang on if you want to chat. And if not, then it was very good to see everybody. And we had people from Japan. Did we say, Danielle, where did you say?
We have Spain and Jordan. So guys, thank you so much for joining. That's awesome.
That was awesome. Thanks again, Dr. Melton and Mike.
So Sean, what you're saying is it's cold beverage time?
Yeah, go for it. Happy hour time.
Just saying, I brought my beer opener.
Yeah.